Welcome to Health Programming for Summer Reading. And as of last week, a little adjustment to this class. We're going to talk about some virtual engagement as well. My name is Michael Balkenhall, and I am the Health Programming Coordinator here at the National Network of Libraries of Medicine Middle Atlantic Region. Before we get into the class, I'm going to go over some housekeeping. All attendees are muted upon entry to the webinar. But please enter any questions or comments that you have into the chat box. As we're going through, if you know a good resource that would complement anything that we're sharing today, please do share it. I'm going to copy the chat at the end and be able to share some of that out with everyone at the end when we do a follow-up email. So yeah, I'll ask a few questions over on the right. If you're not yet familiar, is where the chat box is located. We're also going to be dropping the full resource list. It follows chronologically through the next hour so that you have the link for anything that we might be covering or talking about. Slides for this webinar will be posted after the class on the class page, and photo credits are located in the notes of each slide. So before we get into the class, I'm always curious about where folks are. This is the highest registration I've ever had for a webinar, so there's about 550 folks who registered for it. So I'm curious if you haven't already seen and shared where you're located and what kind of library. So it looks like we have folks from all over the place, some within my region, within New York, New Jersey, Delaware, and Pennsylvania. Thank you all for being here. Some friends from the Southern Adirondack Library System. I know some of you there. Folks from Florida, Clinton, Tennessee. Thank you so much for sharing where you are. So before we get too far into today's webinar, I do want to share some information, 2 resources that are related to the coronavirus, also known as COVID-19. The National Library of Medicine and the NLM are directing all public health inquiries to the Center for Disease Control, which information can be found at coronavirus.gov. And for the latest research information, from the NIH, you could go to nih.gov/coronavirus for information. Many attendees today, like myself, may be working remotely from home. So I encourage you to also check out guidance from your public health departments. A lot of the things we might talk about are suggestions, but absolutely only consider them for your library when they're open, and just take into account all of this is just suggestions. So you might be familiar with some of these acronyms. I thought I would explain pretty briefly who we are. So the National Institute of Health is the nation's leading medical research agency. Many of you might be more familiar with the National Cancer Institute, which is one of the many centers and institutes at the NIH. The National Library of Medicine is also an institute at NIH. It is the world's largest biomedical library, and it maintains and makes available a vast print collection and produces electronic information resources like Medline Plus and PubMed. The NLM is the outreach arm of the National Library of Medicine. We're made up of 8 geographical regions. As I mentioned previously, I'm from the Middle Atlantic region. We serve Pennsylvania, New York, New Jersey, and Delaware, and our office is at the University of Pittsburgh Health Sciences Library System here in Pittsburgh. So at the NLM, our mission is to provide equal access to biomedical information to health professionals, as well as access to quality health information for the general public, so they're better able to make informed decisions about their health. We do this through resources on our website, the funding of projects, in-person trainings, and webinars just like this one. If you are not yet a member, please consider joining. Membership is at the organizational level, completely free of cost, and as a liaison for your organization, you'll simply receive regular correspondence about resources, training, funding opportunities, and more. So our agenda for today. So first, we are going to talk a little bit about health programming for summer reading, and we'll look at some health information and programming resources for all year round. We'll look at some virtual engagement, see how certain libraries are responding to being closed at this time. There are some opportunities around digital events for citizen science that the National Library of Medicine and the NLM are sponsoring. And then I have a few suggestions for upcoming webinars that are related to the topic today. So first and foremost, what comes to mind when you think of health programming in libraries? I'm going to take a look at the chat. This could be something you've done or just generally what you think is associated with health programming in libraries. Answers are coming in fast. So yoga, healthy cooking, nutrition, health fair, absolutely, diabetes management, story walks, yoga, nutrition, again, fitness, Medicare for seniors, absolutely, finding health insurance and navigating those things. Again, fitness classes, 5210 partnerships. I'm actually not sure what that is, so if you don't mind clarifying, I'll take a look later at your answer. Substance abuse and recovery, mental health support, absolutely. So as everyone has suggested, it is really kind of all over the map. It depends on your community and what's best for you. So the National Network of Library Medicine has partnered with the Collaborative Summer Library Program to bring some health programming ideas to your library for summer reading. For anyone not familiar, the Collaborative Summer Library Program, also known as CSLP, is a consortium of states and island nations working together to provide libraries across the country with a shared summer reading theme and supporting materials. These materials include professional artwork, themed promotional items, activities, and evidence-based instruction manuals targeting pre-readers, children, teens, and adults. Each year, about 16,000 libraries participate and host summer reading programs based on the materials developed by CSLP. 2020 is the second year that the NLM has contributed health programming plans. So for 2020, we're going to go through some program ideas on fairy tale nutrition, nature walks, tooth fairy, dental and health story time, and much more, since the theme is Imagine Your Story, folk tales, fairy tales, mythology, and the like. Visit nlm.gov/initiatives summer reading for more information, and this is also in our resource guide. So the first program that we developed, and again, this is some of the ideas come from my work in public service, but also many coordinators around the NLM advised and gave some information. So the first one in the manual or on our website, so to speak, is to promote children's mental health with the help from the Tooth Fairy and local partners. We imagine that you could scale this program up or down to a single story time, or possibly partner with a dentist or an oral health organization to create an oral health fair for kids and families. Some of the activities suggested for this theme are to explore how different cultures experience tooth loss with Throw Your Tooth on the Roof, Tooth Traditions from Around the World. It's a pretty great book if you have never seen it. You can offer a simple craft using coloring pages from the American Dental Association's Mouth Healthy website. Select a puppet with large teeth, such as a shark or walrus, and use an oversized toothbrush to demonstrate brushing habits. A good practice when introducing a new song at Storytime is to have the lyric and some prompts written on a whiteboard or whatever kind of way that, if you have a chalkboard or something like that in your space, to help follow along with visual prompts. This is actually a story time that I used to do a few times when I worked at Carnegie Library of Pittsburgh. And there is a Rafi song called Brush Your Teeth, and it's really long, and I would forget it. So this is the adapted version that I would always use, and it starts at 7:45 in the morning because I think that's a more reasonable time than 1:45, which is when the actual song starts. This is just something I would do, and it's included in the guide. I think it's pretty fun. So there are some suggestions for environmental engagement. So Little Red Riding Hood and Hansel and Gretel embrace the pleasures and the dangers of nature. You could use environmental engagement programs to encourage citizen science, teach about hiking safety, or explore nature's meditative and health benefits. There are some activities to help you facilitate. One of them is to host a citizen science story walk. And like I said, later on, we'll talk a little bit more in depth about citizen science. If your library already has a walking club and you have access to digital resources, you might want to consider adding a citizen science twist. citizen science is public participation in any ongoing scientific research. iNaturalist, you might be familiar with, is a website that has an app and a website that allows individuals to record nature observations and discuss with fellow naturalists and discuss their findings. Possibly a program around hiking safety if you have any outdoors organizations in your community, either national or regional, possibly looking into what things are safe to eat, like mushrooms and berries, or going a little bit further and talking about tick prevention and things like that for folks who might be getting into the outdoors. Forest bathing is a pretty cool concept. If for folks who are stressed and screen addicted, it's great to get outside, and forest bathing is a form of nature therapy that started in Japan in the 1980s. And in this resource plan, there's some information about it and some articles about it that I thought were pretty great. So again, consider partnering with a hiking or nature enthusiast and or conservancies. So fairy tale nutrition. So fairy tales and folklore are bursting with food references, from poisoned apples to magic beans. So I think you could take food and nutrition to a fantastical level and incorporate it into your story time, cooking, or gardening programs. Some of the ideas are a fairy tale nutrition. So think of a story where thinking of like the giant turnip, the giant carrot, Princess and the Pea, Jack and the Beanstalk, and pairing those things possibly with nutrition, nonfiction books about seed life or seed cycles, how they could be used in a story time or a school age program. This is a photo of an art activity that you could include old beans or seed art that might have been discarded or can't be eaten. If you have a garden, again, considering just putting up some signs for giant carrots, peas for a princess, and magic beans. And again, I think this could be scaled down to 5-gallon containers. Enlist children and teens in your community to make signage for the gardens. I think this could be pretty whimsical, and you could share some information about the life cycle of beans and seeds. If you do cooking programs, having healthy eating cook club that embraces magic beans, so thinking of Jack and the Beanstalk or Stone Soup as inspiration, you can host a cooking program that focuses on beans as healthy proteins. You can discuss bean and seed life cycles and share health benefits of a high fiber diet. There's information included in this resource guide on Deadline Plus and Choose My Plate. For example, a one-pot bean soup recipe, or you could possibly have like a chili cook-off or something like that in your community. There's also information for resources for gardening safety and on food allergies, which would be good to consider whenever food is entering the library. So this book club uses graphic novels about veterans to explore veterans' experiences and health. So the resource guides include questions about 2 books. One is At War with Yourself, and the other is When I Returned. Research suggests that we are better at understanding and observing information presented in visual forms, such as comics. Stories are more engaging than factual information alone, and it is easier to remember and empathize with something a friend has experienced rather than hard statistics. Coined by Ian Williams, a physician in the UK, graphic medicine is, quote, the intersection of the medium of comics and the discourse of healthcare. Graphic medicine combines visual storytelling and medicine, creating a unique opportunity for readers to explore and learn about healthcare experiences through comics. I think that this could be, depending on your audience, maybe this is a book club that could be done with teens, or if you actually do have an active veterans group and you're able to enlist someone to assist with it, this could be a good community book talk. And there's a lot of other graphic medicine ideas we'll talk about later too. So there's 2 programs about Harry Potter and Hogwarts, Harry Potter's World and Herbology in Harry Potter, Ginger, Peppermint, and Valerian. If Harry Potter is still endlessly popular at your library, there are 2 program plans for this year's summer reading that include health information. The Magic in Harry Potter series is partially based on Renaissance traditions that played an important role in the development of Western science, including alchemy and natural philosophy. So the National Library of Medicine's exhibition, which is Renaissance Science, Magic, and Medicine in Harry Potter's World, explores the intersection of these worlds, incorporating the works of several 15th and 16th century thinkers. The series examines ethical topics such as the desire for knowledge, the effects of prejudice, and the responsibility that comes with power. Educational resources from the online exhibition. It is an in-person traveling exhibit, but there's a lot of content online. Two things of note, there are 2 coloring books. One is the Garden of Health coloring book, and then one is a Patronus coloring book. Herbology in Harry Potter is a fantastical but grounded in science. You could use herbology as a platform to explore herbs and supplements, make soaps or bath bombs, or focus on book club discussions. I also put some suggestions that are from these resource guides. If you have a therapy dog program, you could Harry Potter theme it as Expecto Patronum. And if you have ever done anything with owl pellets, if you haven't, I should say, I highly recommend it. Owl pellet dissection, they're pretty easy to buy online. And it's a really, really fun activity, and I think it could be branded as, like, what did Hedwig eat? So I think that could be a pretty good time for the right group. So this lesson plan was written about 1.5 years ago, but sure does it seem current. This program plan is a story time centered around germs and washing our hands. There are micro plush toys, or possibly using cutout silhouettes of construction paper to show the shapes of common germs and viruses. Book suggestions for a story time around germs and washing your hands are Sick Simon, which is fantastic, good for a little bit for an older crowd, probably kindergarten up, as well as Tiny Creatures, The World of Microbes, which is the nonfiction book. If it works in your space, there are instructions for when libraries are back open and there is no more social distancing for a turmeric hand wash challenge, as well as the blue chalk ball challenge. And essentially both demonstrate the importance of washing your hands and how easy it is to spread germs across a group. So these might be something to keep in your back pocket for another time and place. We do have some evaluation, so specifically for the program plans that were developed. If you visit our website and use them or not, we would love to hear what you think about them or what you would like to see in future years. So there's an evaluation to take a look at if you're on our website. These program plans can be found on the NLM page. Under Initiatives, there is a Summer Reading tab as well as a Public Libraries tab. This is just a quick look at the home page. You can access both Public Libraries information and Summer Reading from these tabs. As a small note, the Public Libraries tab is scheduled to be updated fairly soon, and it's going to be a one-stop resource guide for public libraries around finding health information, programming, collections, print materials, and other resources. So check it out in a few weeks when we get updated. All right, so moving on from summer reading a bit. Health information and programming resources. So if you are not a stranger to NLM webinars, you know all about this resource, but in case, it's a good reminder. Imagine Medline Plus as your health information Google. It is the National Library of Medicine's resource, consumer health-facing resource. There are health topics on important issues like asthma, cancer, diabetes, drug and supplement information, videos, health quizzes. There is a fantastic medical encyclopedia, so if you have old medical reference books that you are hoping to weed, you should absolutely do so and replace them with a sign that your library staff is happy to help you find stuff on the Medline Plus Medical Encyclopedia. There's also info about clinical trials and Medline Plus magazine, which is something that could still be ordered in bulk to libraries. as well as directories to find practitioners and information in 45 and more languages. I think the best part of Medline Plus is that there are never any endorsements or advertisements. And Medline Plus doesn't create information, but it aggregates it from across government and university resources like the NIH, Mayo Clinic, and the Nemours Foundation. If you're thinking of, or you already have nutrition or cooking programs, Medline Plus does have healthy recipes. This is a recipe for a classic honey flan from the National Heart, Lung, and Blood Institute, which is one of the 37 institutes of the NIH. Recipes like this are found on Medline Plus, and they link out to other respected resources. So if you're thinking of a creative way to make it available, possibly this is for you. And of course, there weren't a ton of sweets, but there was this recipe for classic honey flan. As I have sweet tooth, it was the recipe I decided to share. Okay, so the NLM and the ALA, the American Library Association, have partnered through the library's Transform Public Awareness campaign to create a free toolkit for Health Literacy Month, which is held in every October. The NLM and the ALA's partnership works to equip professionals with customizable tools of how libraries support health literacy in their communities. The Health Literacy Toolkit provides key messages, program ideas, downloadable marketing materials, including bookmark templates and social media graphics for libraries to use all year long, as well as in October. There is a wide range of health literacy topics that cover nutrition, aging, chronic illness, and more. Taking a quick look at this, is there any message that you find resonates the most for you? I'm always kind of curious, at least anecdotally, to see what folks think of these. There is one that is absolutely my favorite. I'm wondering if anyone is interested in sharing. So yeah, fake news is harmful is absolutely the most, the one that whenever we print them and we distribute them at conferences and whatnot, always goes really fast. But the one that I actually love the most is because libraries are partners in the healthy community, because they are. So I see a few people like that one too. So that's the positive message that I guess I like a little bit more. And exactly, and the one for I like the rare diseases are more common than you think, because absolutely they are. So sneak preview, that's me. This is a health outreach and programming resource guide that I maintain. There's a link to it in the resource guide. There's all kinds of ideas for programs in a box. And as you can see, Universe of Stories was last year's summer reading theme. If you still can't get space out of your head, there's a lot of program ideas around there. And most of this is going to soon be on the public libraries page, right on our homepage for the NLM. Engage for Health is a turnkey community education program. It's designed to improve participants' health literacy. It's a quote-unquote program in the box that's available from the NLM. It's been proven to encourage doctor-patient communication and improve the understanding of healthcare. It was developed in partnership with physicians, and it's a 1-hour flexible program that includes everything you would need to conduct your own program. There are presentation slides, speaker notes, a role-play script, and program evaluation and marketing materials. It's a pretty cool thing. If you have a regular program, I've seen this be really successful with seniors, where maybe you're able to bring in a physician, a nurse, or a pharmacist to do a little bit of a talk, and you could go through some tips for improving doctor-patient communication. I said, like, this is pretty flexible, and all the information is online for it. All right, so the NLM Reading Club is a selection of ready-to-use book titles, along with free and downloadable materials designed to help libraries support the health information needs in their communities. The sections are tied to national health observances, like Mental Health Awareness Month in May. To request an NLM Reading Club kit, there is an application form online, Unfortunately, it's not available in all regions of the NLM, but the online information, such as the book list and the discussion guides, are all available online for free. This is only a short list, but there is book club ideas around disability, LGBTQ health, heart health, mental health, vaccines, healthy aging, and more. So it's pretty cool. This is an example of just a screenshot of the NLM Reading Club for Mental Health Awareness Month. And this book is RX by Rachel Lindsay. It's a graphic memoir about the treatment of mental illness, treating mental illness as a commodity, and the often unavoidable choice between sanity and happiness. It's a semi-autobiographical account of moving to New York City and needing health insurance. It's a pretty great book, and then ending up working in advertising for pharmaceuticals. It's a pretty good book. I'm not sure, I saw in the comments, I'm not sure if I would recommend it for teens, but definitely for new adults, folks in their 20s and older. It's a pretty cool one, and it's a graphic format. As I mentioned, the discussion guides are all available online. They're often supplied from the publishers. And again, I just wanted to briefly revisit graphic medicine. If you couldn't think of a title, here are a few that are pretty popular. In children's and teen world, El Defo by C.C. Bell is pretty fantastic. Raina Telgemeier, I don't have a screenshot of it, but Guts is a book about anxiety. It's pretty great for teens. One book that I have that I haven't had a moment to read is Taking Turns, and it's stories from an HIV/AIDS care unit from MK Zerwick. But a lot of these titles are pretty fantastic, and graphicmedicine.org is a great place to find it. And again, that could be found right on your resource guide. Especially, I guess I bring up graphic novels. Maybe you work in a library where you don't have huge collections of graphic novels, but it really is such a great medium for folks to retain, and for folks who do not have really advanced literacy skills. I personally love graphic novels of all kinds, but I think graphic medicine is a really great way to add some high-value content to those kind of collections. Earlier, we talked a bit about the Harry Potter exhibition, but there are numerous exhibitions from the National Library of Medicine. They are traveling exhibits that are made available free of charge to public, university, and medical libraries, as well as cultural centers. Though there is a shipping fee, you should always talk to your NLM Regional Medical Library to inquire about funding sources, either to subsidize the cost of shipping and or maybe speakers or honorarium, different things like that that are often available. The traveling exhibit is comprised of banners. There's usually 6 of them about a particular topic, and the main information is, again, online. The banners provide an opportunity to highlight your services or maybe a part of your collection, or maybe to bring in some events if you have a big public space to fill. The permanent online exhibitions are enhanced by educational and career resources for K-12 as well as college and university students. Here, very briefly, I'll talk about the 3 that I featured here. Confronting Violence highlights the role that nurses played in the fight against domestic violence, including stories of nurse reformers on the front lines, in shelters and emergency rooms, to political advocacy leading to the passage of the 1994 Violence Against Women Act. Another is Native Voices, Native Peoples. It's concepts of health and illness, which explores the interconnectedness of wellness, illness, and cultural life for Native Americans, Alaska Natives, and Native Hawaiians. And last but not least, graphic medicine, ill-conceived and well-drawn, is a NLM traveling exhibit that focuses on comics as graphic novels in the form of communication. Graphic medicine, we hosted this graphic medicine exhibition at the University of Pittsburgh Health Sciences Library over last summer. And we paired it with a talk by Dr. Jay Hosler, who's a biologist and cartoonist from Juniata College. Did a really great talk for students as well as staff. And we had a few different activities in this space as well. Here are two photos of what the exhibits look like. Like I said, there are 6 of them most often. And this is the one that we had in our library over the summer. Our activity station was to draw an illness. And this was a student submission for hemochromatosis. So pretty outstanding. Again, this is a medical school students. But this was a pretty cool art activity that went along with the exhibit. I think just the same, it could be used as a concept or a prompt for children or teens, where you could say draw a stick figure sneezing or a symptom and try to identify it. I think that could be pretty fun to go along with it. So moving along, Go for Life is an exercise and physical activity campaign from the National Institute of Aging at NIH. It's designed to help you stay fit and physically active in your daily life, motivating older adults to become physically active for their first time or to return to exercise after a break in their routines, or to build more exercise or physical activity into their weekly routines are the essential elements of Go for Life. The website offers free exercises, motivational tips, free resources to help you get ready, get exercising, and keep going. The Go for Life campaign includes evidence-based exercise guides in both English and Spanish, exercise videos, an interactive website, and a national outreach campaign. You can order free publications in bulk from Go for Life as well. I have talked to folks who have had success with the online form for bulk. And if you're not really sure what you want, they have an 800 number. I'm not sure right now if it's being staffed, where you could kind of get a sample for your library. These are really fantastic. They are high quality. I actually keep one with me. Through most of our work, we travel doing teaching and visiting conferences. As you can imagine, my schedule is mostly clear now. But in hotel rooms, I will kind of use Go for Life because if I want to get a little bit of exercise, you don't need a lot of equipment or anything. You could do things from a chair up against a wall. There's some really great tips for, I know it's geared for older folks, but really it's great for everyone of all ages, especially for patrons that just love to take anything that is for free available in your library. So another great website, Let's Move in Libraries. It's an international initiative to get people of all ages and abilities moving. It aims to support healthy communities. They have a reach to for impact for public libraries through health programming like story walks, youth classes, gardens, the circulation of fitness equipment, and much, much more. Let's Move in Libraries members can come together to answer the call for action. This was based off of Let's Move in Libraries, was based off of and receives its inspiration from former First Lady Michelle Obama's Let's Move campaign, which was from 2010 to 2017 and focused on increasing physical activity and healthy living among Americans. They have a really great newsletter that I'm going to share in a little bit. But one of the great things on their website, especially if you are in a smaller library, they have examples of liability waivers and other things to consider before doing this kind of programming in your library. So Programming Librarian is the website of the ALA, provides the resources, connections, and opportunities libraries need to fill their role as centers of cultural and civic life. It is a place for library professionals to share, learn, and be inspired to present excellent programming in their communities. Again, it's a resource of the ALA, and it features resources, ideas, and professional development opportunities as well. If you are really proud of work going on in your library, you can share success stories with the programming librarian community too. Library professionals are invited to upload information about their programs, including description, images, attachments, marketing, budget details, reading lists, etc., and more. The idea is to create a database of program ideas so that libraries can continue to build on each other's good work. And it's a website that is really trying to help us to not create the wheel over and over in public libraries. So does anyone here know of Librarian? When I worked in children's and teen services, it was one of my absolute favorite resources. And I think that there is a health and fitness component to it as well. So Librarian, for those who don't know, is a Storytime website and blog from 2 librarians in Canada. The webpage is an amazing resource for children's library staff looking for new routines, tricks, and songs. They have compiled story times that are being streamed online during widespread library shutdowns. I think the health and fitness related YouTube playlists, there are sections on body parts, finger plays and tickles, emotions and feelings story time, as well as incorporating more movement and dancing into your story time. So I see at least all the children's library folks that are in the comments resounding yes that they've heard of it. Just a friendly reminder that it exists. It's a pretty fantastic resource. So health and digital literacy are, of course, connected. Many of the best and certainly the most up-to-date health information lives online. So digitallearn.org is a free resource for promoting digital literacy in your library, both in person and virtually. In addition to hosting tools and resources for educators, there are modules that anyone can attempt remotely. So this might be a challenge to offer digitally, but if you work for a small library that is just looking to share out some new content, this might be it. Many library users, of course, don't have computers at home, but this might be a tool for some folks. It's pretty great. There are tools and resources for trainers. Let's say if you're doing this as an in-person class, and then anyone can go to this website and just go through different things about like setting up an email and not falling for phishing scams. It's pretty great. So we're going to talk a little bit about virtual engagement, how some public libraries are responding to closure with increased online activity. We'll look at some samples, talk about accessibility, and then we'll talk about some more learning later on too. So again, this is from Librarian. They are pulling together a list of live streaming story times. It is, of course, not all-encompassing. As I kind of looked around in the last few days, it seems like most libraries are. It is one program that they are definitely putting online. As mentioned, this is Librarian. A lot of libraries are live streaming their story time mostly through social media, notably Facebook Live, which as you know, if you have ever gone to Facebook without logging into it, it gets very angry and it wants you to be logged in. So there are some issues with being behind a barrier, but so social media is also finding people where they are. It looks like that's what most libraries are offering. Feel free to take a look at this and see what some of your other colleagues are doing. And if you don't have the capacity for it, maybe share out your favorite. So looking at what some larger libraries are doing, Brooklyn Public Library actually has an award from my office from the Middle Atlantic region to do health programming. And they've moved some of them online. So they are offering digital meditation for teens, which seems pretty cool. And then, frankly, I would love to see how Pet Partners Reading to Dog program works online. It seems like they have a pretty good idea. Yeah, someone commented that Facebook Live can be viewed without a Facebook account. That is true. The only thing that there's often a lot of pop-ups trying to get you to endlessly log in. So it just kind of inhibits the view. But yeah, for sure. It's definitely a possibility. That's something from Brooklyn. So I'm not sure if I mentioned where I worked, but I was a children's and teen librarian at Carnegie Library, Pittsburgh, customer services, many a position over about 10 years. The library has been closed for just over 3 weeks here. And a virtual reading challenge that they are using Beanstack, their summer reading software, is to stay in and read. So some youth librarians at Peters Township Library, which is south of Pittsburgh, created a Hogwarts digital escape room using Google Docs, or Google Form rather. And if you are not familiar with escape rooms, they are usually in-person, themed adventure game. Groups are required to find hidden clues and solve puzzles in order to proceed through the game or to quote-unquote escape the room. I recently saw that this game has gone viral and it's been played about 225,000 times. And I actually look forward to doing it. I haven't had the opportunity to, but I think this is a pretty cool option. Another small library near Pittsburgh simply posted a video of a library staff member touring their closed library while puppets were set up as library staff. I think this was a short and pretty cute way for library regulars who might really be missing their space or their library staff, their library buddies, so to speak. So if you are still someone who is reporting to your library building, or you have some content to provide a visual tour, it might be a kind of a cool thing for you to show. So earlier I mentioned Let's Move in Libraries. They have a monthly newsletter, and the April 2020 newsletter kind of was a round robin of lots of examples of what libraries are doing to make their fitness classes and their nature engagement and many, many more programs available online. Instead of going through the dozens of examples, it is linked in your handout. So if you're curious what other libraries are doing, especially with regard to movement and fitness, please do check out that list. So if you don't have the time or ability to make new content, which is completely understandable, don't hesitate to share some existing resources. This one is one of many nature cams that are available free online. This one in particular is explore.org. There are many places online where you could watch animal and nature live streams from all around the world. Sharing a free resource like explore.org might be a low-cost way to engage your patrons and reduce stress. I think these things are pretty awesome, and I often have them in the background on my computer. So as a lot of programs and digital content is going online, I wanted to make a small note about accessibility. Last week, Tiestarter hosted a webinar with Kelly Ham of she's a colleague of ours from the NLM Pacific Southwest region. The webinar was recorded and will soon be posted shortly on the Tiestarter YouTube page. In this webinar, Kelly covered design and accessibility techniques and more, including screen readers and other voice-to-text tools, using closed captioning for video, television, or digital media, using color effectively and considering color blindness, good contrast, and other things like that for readability. So if you are new to creating content online, and maybe that's something that you've been doing, check out the recording. It was pretty great. And the title of the webinar, as on the screen, it was Digital Accessibility Techniques for Creating User-Friendly Presentations, Documents, and Content. Since I mentioned Tiestarter, that brings us to another section on citizen science. So we'll talk about how to get started with citizen science. I defined it very briefly earlier, and we'll go over some remote activities and opportunities that are going on this month as well. So some of you might know citizen science and others might not at all, so we'll go a little bit further into defining it. The Citizen Science Association defines citizen science as the involvement of the public in scientific research, whether it's community-driven research or global investigations. Going a bit deeper into this definition, Tiestarter notes that there are 4 key features of citizen science practice. Anyone can participate. Participants use the same protocol so that data can be combined and high quality. Data can help scientists to come to real conclusions, and a wider community of scientists and volunteers work together and share data to which both the public and scientists have access. Another good way to think of citizen science is by what it is not. It is not participating in a medical trial or a social science survey. Citizen science happens in so many disciplines: astronomy, engineering, ecology, psychology, and as well as genetics and medical projects. So the Audubon Bird app, has anyone used the Audubon Bird app or iNaturalist? If so, you might be a citizen scientist. For Audubon app, they have annual counts like the Christmas count that are a good way to engage animal birders, but they also have some also really cool apps. Cornell Extension also has a pretty great one too for tracking and sharing out birds. There are a lot of local chapters too, so there might be some partners to find there too. So Tiestarter is a resource where you can search from about 1,200 available projects to find one that you could participate or support in your library or community. You can search Tiestarter by topic or location. There are a lot of fun ongoing projects that could be interesting to many members of your community. There's projects for dog lovers, kids who are interested in gaming, and home gardeners as well. We'll look at some resources since Citizen Science Month is in April. While in-person events are not happening around citizen science, Tiestarter is willing to lend support to those who would like to use their online platform to engage folks in their communities. And someone looks like there is a question, is there a flower and ID app? So someone mentioned PlaneSnap as well as iNaturalist is another one that I think is pretty great. So the NLM is a partner of Tiestarter. On our crowdsourcing and citizen science page, you'll find resources for hosting citizen science events in person, as well as some tips for doing it digitally. There are featured projects that can be done completely remotely with a few tools and resources like the Librarian Community Guide to Citizen Science that, if you're not super familiar, will walk you through what other libraries have done and help you really visualize how this could be kind of like STEM and STEAM all grown up in your library. So these are some of the events that the National Library of Medicine has endorsed related to finding lead in water pipes and mapping it for crowd to source. The observation of nature in IC Change, which is an iNaturalist program, furthering Alzheimer's research with stall catchers. It is a game that you can play mobilely, and as well as tracking debris and the flu symptoms. And then Globe at Night is a way to track light pollution in your community. These can all mostly be done with very little to no tools and remotely. So whether you would host it or if you were interested in just kind of pushing and sharing those out, here are a couple that any amateur citizen scientist could participate in. I wanted to share a couple webinars about how other organizations are responding to COVID-19 as well. Our friends over at the Greater Midwest region of the NLM are hosting a webinar with an associate director of community services for Oceanside Library in New York. It's going to be about doing virtual programming in a health crisis, and that's coming up this Friday. Webjunction, also known as is a outreach arm of OCLC, is hosting a virtual town hall, libraries in the COVID-19 crisis. And that is a 90-minute webinar that is scheduled for next week. And last I checked, there was still room for folks to register. The registration links are in the resource guide that you're welcome to take a look back through again. So we finished a few minutes early. Thank you so much for attending today. I'm going to take a look back through the chat and stay on the call. If there was any questions that I might have missed, please do share. Anyone who shared out links, I'm going to compile those. In about 2 to 3 weeks, the recording for this webinar will be available, and you'll be able to share it out with folks. And then when I send out the recording, if there were any follow-up questions that I missed, I will be sure to answer them. So I'm going to take a peek through the chat. As folks exit the call, I do want to say you should get a pop-up for a short evaluation. Always very curious for feedback. If for some reason you have the best pop-up blocker and you don't get it, feel free to shoot me an email or wait for that follow-up email so that you could claim CE from the Medical Library Association. This is for 1 credit for today, since this was a 1-hour webinar. Thanks so much to all the kind words. I'm going to look through and see if there was anything that I could address. Yeah, someone asked about Tiestarter. Yeah, Tiestarter is the name of the organization. Someone shared that they have the Cornell app on their phone. Yeah, the Cornell lab one is pretty great as well. There was a question about this being recorded. Absolutely, it'll be recorded. I look forward to kind of looking through the comments. It's pretty hard to check them while looking at my notes and making sure I'm on the right screen. It's very interesting teaching this kind of webinar from home. But again, thank you all so much for your time. I'm going to go on mute, and I will take a look for. Let's see, there was one question. Yeah, so the Libraries Transform campaign, there is multilingual information, and there's also multilingual information on Medline Plus and Health Reach to find some more information too. If you don't find that, or if there was anything I missed, please do just email me directly.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.